Acetabular fractures. 1. Anatomy. The acetabulum consists of two columns forming an inverted Y shape. Anterior column extends from the iliac crest to the symphysis pubis, including the anterior ilium, quadrilateral surface, and the anterior wall and dome. Posterior column extends from the greater sciatic notch to the ischial tuberosity, including the posterior wall and dome, iliopectineal eminence, and the greater and lesser sciatic notches. Dome. Superior weight-bearing, WB, area at the junction of both columns. Corona mortis. Found in 10 to 15% of cases. A communication between the inferior epigastric artery, external iliac, and the obturator artery, internal iliac, which may be injured during the ilioinguinal approach. 2. Classification. Judae-laternal classification. Elementary patterns. Posterior wall, posterior column, anterior wall, anterior column, transverse. Associated patterns. T-shaped. Posterior column and posterior wall. Transverse and posterior wall. Anterior column and posterior hemitransverse. Both columns. 3. Nerve involvement. Sciatic nerve, affected in posterior column fractures. Femoral nerve, affected in anterior column fractures. 4. Imaging. X-ray. AP view. Key landmarks include the iliopectineal line, anterior column, ilioischial line, posterior column, anterior and posterior lips, anterior wall, roof, and inferomedial part of the floor. Oblique. Judae. Views. Posterior column, 45 degrees external rotation, iliac oblique. Anterior wall, 45 degrees internal rotation, obturator oblique. Anterior column, 45 degrees internal rotation, iliac oblique. Posterior wall, 45 degrees external rotation, obturator oblique. 5. Treatment. Conservative. Indications. Skeletal traction for fractures with displacement less than 2 mm, 20% posterior wall involvement, infratectal transverse fractures, or intact acetabulum. Operative. Indications. Displacement greater than 2 mm. Large posterior wall, greater than 20%. Instability or incarcerated intraarticular fragment. Irreducible fracture dislocation. Approaches. Coker-Langenbeck, for posterior column and posterior wall fractures, transverse fractures. Ilioinguinal approach, for anterior column and anterior wall fractures. Extensive iliofemoral approach, for transverse and associated both column fractures. Modified Stoppa approach, for quadrilateral plate fractures. And 6. Complications. Myositis ossificans, avascular necrosis, AVN. Infection.